to the Thought Snob Podcast. I'm Paula Swope. Let's get snobby. Dr. Carl Paige just left the Thought Snob Podcast studio, and I hated seeing him go because I could have soaked up his brilliance until midnight. Dr. Paige and his wife Terry are co-founders of the Medical Transformation Center, which is a state-of-the-art wellness center in Louisville, Kentucky that specializes in personalized cellular and regenerative medicine. Dr. Paige and I talked about mental wellness and the whole health approach to treatment. I invite you to listen to our episode and learn about how he combines traditional treatment methods with cellular and regenerative medicine, which aims to repair cellular damage, support cellular function, and improve health on a deeper biological level. Anxiety plagues the lives of so many people, but you don't have to accept it as being part of your identity. And Dr. Paige and I talk quite a bit about that. I invite you to listen to our episode and learn how integrative and regenerative approaches to mental health emphasize personalized care and target the root causes of anxiety. Dr. Paige's approach is rooted in common sense, and if you don't target the root causes of anxiety, well, how can you fix it? The progressive model of mental health care that is offered at the Medical Transformation Center complements traditional treatment methods while adding cutting-edge therapies such as peptide therapy, nutritional supplementation, advanced diagnostic testing, and other evidence-based solutions that offer a new hope for individuals navigating anxiety. And for my ladies out there, I asked Dr. Paige to talk about stem cell therapy facials, so you got to listen to the end. All right, so the topic is mental wellness.
Okay.
And the whole health approach to treatment with a focus on anxiety, right? We're going to talk about anxiety.
Okay.
And I looked up some statistics this morning just to see what's trending with anxiety. And it looks like that, as usual, America has the highest anxiety rates of anybody, and higher now than the rates have been in a while. It seems like they are increasing. And it looks as though people between the ages of, I think, 18 to late 20s seem to be struggling with it the most. Is that what you're seeing with your patients?
Well, anxiety is very common. The stuff they report's always hard because there's a reporting bias. I mean, everything's so real time now with, the internet and the social media, and so it's always I don't know that we have data comparing 1850 to now, because we didn't have as much the ability to collect the data.
Right.
But I do think that generation that sort of went through COVID was hard on everybody, but that group that was adolescent, pre-adolescent, and young adult, COVID certainly drove a lot of anxiety. I mean, everybody was, and scared to death, and the fear was, gasoline thrown on the fear by the media and everything. So they grew up in a real anxious time.
Mm-hmm.
On top of it, it's just a stressful, anxious kind of place we live in. Yeah.
It's kind of funny. I have a 14-year-old stepdaughter, and I'm also close with my cousin's little girl, who's 9.
Mm-hmm.
And both of them have an awareness about anxiety that I just didn't have at their age.
Yeah.
I didn't know what I was feeling. I had no awareness, no education about it whatsoever. And they talk about it. It's the norm. It's just the norm. Mm-hmm. And a light bulb went off the other day. I was talking to my stepdaughter, and she was talking about how the loud noises in the cafeteria always make her jump because she wonders if there's a school shooting going on. And I'm like, good Lord.
Yeah, we didn't have to worry about that stuff when we were kids. Nobody
stuff.
would have thought about it.
Nobody ever even thought about it.
Yeah.
Yeah, and it's really something how things have changed. But mental health issues have always been around. They were just shoved under the rug.
Right.
and anxiety's always been prevalent. It's just people didn't know what it was or how to deal with it, I think. And I think that even though it seems like more people have it now, and I agree with you, I think it's maybe because of more reporting, and I do think some of the studies are possibly even spurious.
Mhm.
Um, but there seems to be more of an awareness around mental wellness. And so I would love to know why you think it's important to take a whole health approach to treatment. And I'd just really like to know what your approach is to helping people with anxiety.
Sure. Well, I ended up in this space coming from a traditional primary care setting. I was an internist and a pediatrician. Still do some of those kind of on the side, now.
Hmm.
But part of those that paradigm is really kind of what led me to that. We would see a lot of patients who would have mental health issues, whatever the label was, depression, anxiety, OCD. They're all sort of different ways your neurotransmitters maybe get out of balance,
Hmm.
and it's often those patients. What my tools at that time when I was back in regular primary care were label something and then provides whatever the latest pharmaceutical agent was for it,
Sure.
and that seemed like it didn't work really well, and that's kind of what the data would show you when you look at it. It wasn't super effective, and it was intellectually kind of numbing to just have this binary, you have this, therefore you get this. That's assuming the body was missing some recently invented pharmaceutical, and that's what was wrong.
Yeah.
It just didn't make sense intellectually. So that's part of that paradigm that sort of drove me into the way we approach things now, which is really looking more at, just from a global standpoint, we look at, immune health. How's the immune system working? Because we know of a lot of this dysregulation in neurotransmitters in your brain is a lot of a neuro auto-inflammatory response or neuroimmune response, which is then driven by other place we look is really in the GI tract. How's your GI tract connecting with the outside world? Is it something in food that's triggered it? Have you got that medical term intestinal permeability, or more of a lay term leaky gut? And we're aware now that um, breakdown of the immune regulation at the gut layer crosses the blood brain barrier, which then can create a central nervous system inflammatory response.
Mhm.
And then we look at energy production, which is really how do your cells take your food, fat, protein, carbs, and then the fourth one, ketones, and turn them into energy that it can process. And dysregulation across those immune gut, energy regulation at the cellular level really drives a lot of that mood stuff. Now, of course, there's the environmental factors, which, life trauma and everything that happens that way. I won't go into all the details, but it's people are usually aware of those triggers,
Right.
and if you take somebody maybe that's genetically has trouble processing certain neurotransmitters or clearing catecholamines, which are sort of the excitatory neurotransmitters, and they live in a dysfunctional setting growing up, whether it's drugs and alcohol or abuse, they at a certain point their system's going to decompensate with that. They may develop some coping mechanisms that survival mechanisms that get them through it, but then those type of mechanisms may not translate well to adolescence, adulthood, relationships, and they don't realize that at the time that's what's going on, but they carry those tools they develop when they're little, and they don't sometimes translate. That survival tool as a child doesn't translate well to having a husband and a wife and 3 kids.
Right.
Yeah.
Some of my coping mechanisms, I still recognize those coming out to this day.
Yeah.
Our subconscious programming is really something.
Yeah, and it's yeah, well, what you learn early. I wish I'd have learned guitar when I was, like, 6 or something, and I'd
Right.
probably be better at it than I am now.
Well, yeah. God,
It would be ingrained in there.
I tried to take guitar lessons when I was in my 20s,
Yeah.
and I got so frustrated. Like, I really underestimated how difficult it was going to be. How long have you been playing the guitar? I know this is totally off
Oh,
topic,
we
but I
jumped
want to
around
know.
there pretty
That's
quickly. That's
okay.
my fault for interrupting you.
No, I'll
Sorry
get
about
back
that.
to, we'll get back to business in a minute. I'm just curious.
I started playing guitar when I think my uncle, he used to play in some country bands, and when he would come around, he would teach me some things. So it was probably late single digits or, early teens.
Okay.
Yeah.
All right. Yeah.
Which is young enough to, have it ingrained as something now that I still do when I'm in my mid 60s.
Right. Right. Okay. All right. Yeah, I was just curious. So for the people who are listening and for myself, I would love for you to explain what exactly is cellular and regenerative medicine, and how does it support mental health treatment?
Okay. Well, I think for what I do now, it has, I think, an imaging and a branding, some concerns there. It's like so many people come up with labels and names, and what do you call what I do now? It is really more integrating traditional Western medicine with a lot of the things in Eastern medicine. I'm not a TCM or traditional Chinese medicine practitioner, but herbal medicine, botanical medicine, regenerative medicine might be how do we augment the body's ability to use the resources it has to perform at its highest. That might be taking someone who's got a breakdown in an abnormality or a diagnosis in the traditional Western medicine sense, or somebody who just wants to perform better, function better. In their 30s, 40s, and 50s. How do you get more out of this system? So in how we might approach someone with a mental health issue is really how do we optimize the cellular pathways of coping with, redox potential, energy production, managing inflammation, managing the immune response. So those type of things. The body is a multicellular organism, so it's a bunch of billions of cells that get together and decide to do one thing. With some, cells specialized, all the cells function on the same rules. So if you can optimize the environment that a cell's functioning in, then this whole system works better.
Mhm. So I want to ask you if you agree with Deepak Chopra about something. When I was at the Chopra Center studying, I was really clueless about my anatomy.
Mhm.
And I swear I think most people are.
Mhm.
And it's just like the first time that he did the lecture about the vagus nerve. I
Right.
mean, I just had light bulbs going off everywhere. I mean, he had me. I mean, I was like totally just real
Well, he was
with
hooked
that.
at that point. Yeah.
Yeah. And he says that inflammation is the root cause of nearly every disease known to man. Do you agree with that?
Well, I would say not necessarily it's the root cause, but it certainly is the fuel that can potentiate it and augment it. It's a little more complicated than that, but I think that's certainly one of the biggest players. And
Mhm.
yeah, I think there's a little more than just inflammatory response. But like I said, there's inflammation, autoimmunity, there's cellular redox balance, there's energy production, all of those things at the cellular level are going to impact that. And inflammation can be good. I mean, if you sprain your ankle, a bunch of things rush in there to inflame it and then allow it to heal.
Right.
And we even use inflammation in some of the regenerative things we do by signaling that inflammatory response, whether it's at a joint or working with the facial stuff you ask about, to
Mhm.
stimulate collagen formation, so you can use the inflammatory response in a positive way.
Mhm.
It's oftentimes when it becomes dysregulated or out of control that might be the root of a chronic disease, because it's a normal process with
Right.
inflammation. Right?
And that's how I understand it too. And I'm looking at it from, through the perspective, through the lens of where people go day to day and that sympathetic nervous system is on. Like
Mhm.
the minute their feet hit the floor in the mornings, it
Probably
is
before they hit the floor.
probably, I
Yeah,
mean,
with cortisol, yeah, spikes,
right.
right, right.
And I used to wake up at, 3 or 4 or 5 o'clock in the morning overwhelmed by anxiety.
Mhm.
And when I used to feel like that, I don't anymore, but when I used to feel like that, I would go back to sleep, but I would wake up and it was just like this feeling, this icky feeling, and it never went away. And I really feel like during that time in my life, I just stayed in fight, flight, freeze all the time because my sympathetic nervous system was so dysregulated.
Mhm.
And I just feel like I was being threatened all the time, even though I wasn't. And
Yeah,
that's really what happens when your nervous system gets dysregulated.
yeah,
And when we go day to day and that sympathetic nervous system is turned on and we're not aware of what's happening, then that stress just it accumulates and it turns into chronic stress. And the next thing you know, you've got all this inflammation in your body and you're not doing anything to interrupt it and release it or alleviate it. And I think that that process is what caused me to be in poor health the first basically 30 years or so of my life. I mean, I'm 48 years old right now, and I'm in better health and better shape than I've ever been in my life, and I'm postmenopausal, and a lot of women cannot say that.
Right, right.
And it's attributed to a lot of it is attributed to, taking a more whole body, approach to my health, realizing I am in control of my health and using what I have to heal.
Mhm.
And I've already got everything I need to heal is how I look at it, but it's like certain things need to prompt that. And correct me if I'm wrong, but that's how I understand your approach to whole body health. Am I right? Am I on the right track with that?
We don't throw out Western medicine completely. It's really
Oh,
good at
me
managing a disaster.
sure. Oh
And that's
God,
kind
yeah.
of what it's designed for and what it's
Mhm.
most focused upon is wait until the system is broken and then let's fix it.
Right.
And sometimes people get themselves in a spot where they've kind of gone down that pathway too long or with lifestyle habits combined with their genetics and environmental factors that they've created a crisis from a health standpoint.
Mhm.
And, you need Western healthcare when you reach that crisis. But ideally, we would like to, we take people before they get there who might try to identify what those risk factors are and modify them early, modify their epigenetic environment with lifestyle, nutrition, exercise. Sometimes it's augmenting that with peptides or it might be energy medicine and that type of things to help them achieve optimum function for their body to lower the probability that they might manifest whatever their genetic potential to have something bad happen was.
Mhm.
Sometimes patients come in and they've already had this bad event and we try to move them back closer to where they're in homeostasis and try to prevent the next one, and,
Mhm.
and that's okay. We don't do the crisis management piece of it now. I did that for 30 years. So,
Mhm.
at some point you got to go home and go to sleep, not wake up in the middle of the night. So I've made that choice for my own
Yeah.
health,
Right.
after 30 years of doing that. It was,
Yeah.
yeah.
Yeah, because you realize it's not working anymore.
Well, you can only do it for so long. It's like
Yeah.
you can only be frontline, always in the fight or flight mode.
Mhm.
It has consequences for everyone.
Oh,
A
yeah.
lot of people tell me they function best in stress. I'm like, you might, but you're not going to function for a really long time in a
Not long
stress
term.
environment. Yeah.
No. And I think it just absolutely destroys, health span,
Yeah.
longevity.
Yeah.
You can't carry on like that.
No,
You
no,
just
it's not.
can't.
No, you can't. And it's people, young people can do it. I think back about things I did when I was in residency or medical school or, first started practice. I'm like, I don't, looks really hard when I look back at it. At the time, I was just day to day going through it. So
Mhm.
you're kind of in survival mode and
Yeah.
making it through that and you can, but it has consequences.
Mhm.
And the parasympathetic side of the nervous system and that's the anti-inflammatory side of the nervous
Mhm.
system works on the immune response to help it regulate itself properly. So, working in that on the vagal nerve tone is imperative for most of the things we deal with
Mhm.
for people to reach optimum health, and they just don't know how to do it. And we can give them tools to do it. We can give them exercises and books to read and go do yoga and Pilates. And, you can biohack it with different electrical devices that might stimulate the vagus nerve or vibratory devices that might stimulate vagus nerve. But part of it is just rest, relaxing, deep breathing, slowing down a little bit, kind of spending some time working on that space. You have to be intentional
Mhm.
about it to do it, and you have to make that time to massage that part of your nervous system.
Mhm.
And we no, it's not like I think you said in your podcast. It's not really valued in the 21st century. It's almost like you're admitting weakness if you do that. But
That is true.
yeah.
Yeah, that is true. I remember I was in graduate school. So this has been many, many years ago. Um, I went into college as a non-traditional student. So I was 25 when I started working on my bachelor's. So I was probably about 32 years old, I would say. And I went to my primary care physician and I said, I've got to do a lot of public speaking and I have stage fright.
Hmm.
And I did. I mean, I shook from head to toe. It was a train wreck.
It was just another way to describe anxiety. You were having massive anxiety. Just in
Exact
the stage setting. Yeah.
exactly. And I just would get up there and just shake, and it made everything worse
Mhm.
because I knew people could see me shaking. I could feel myself shaking. And I had no awareness that I actually had control over that.
Mhm.
My primary care physician, she put me in a box,
Mhm.
didn't ask me any other questions, and said, "Well, you need Xanax."
Mhm.
I was like, "Oh, okay." So she prescribed me Xanax. and it was like the lowest dosage. I think at 0.25 or something. I can't remember. And I didn't abuse them, and I didn't get addicted. Thank God. I don't have an addictive personality, and I didn't necessarily like the way they made me feel. But I would take a Xanax, and I was completely reliant on that Xanax. And I would take a Xanax before I had to go and get on that stage and do public speaking or get on an airplane or whatever it was that gave me this massive anxiety. And, that worked okay for me for a while, but I got to the point that I couldn't get the prescription anymore.
Right.
And I'm like, okay, I got to figure something out here. Well, it was around that time, and this was several years later, that I had been turned on to another way of life and realized that I was in complete control of what was going on with me, and became very mindful about it. And I learned about my nervous system. This is what I was saying earlier. I knew very little about my anatomy. I had never heard of the vagus nerve before.
Most people don't. They forgot. Ones who've heard of it forgot about it.
Forgot about it. And it's called our healing nerve, and
Right.
because that's what it is. And I started doing things to stimulate that and to turn on my parasympathetic nervous system. I don't have stage fright anymore.
Mm-hmm.
And then I worked to release a lot of subconscious interference about who I was, and learned about my subconscious beliefs. I've never been to a medical doctor, is why I'm going down this path with you. And I love my medical doctors. I mean, I see my doctors annually. Believe in them wholeheartedly, will continue to see them, but I have never had a medical doctor ask me anything about my experiences or my emotions
Mm-hmm.
or anything like that. And what with me, the anxiety was coming from those things.
Right.
And it was something that started when I was very, 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 very young. And when a patient comes to you and they're like, Dr. Paige, I've got stage fright, or I fall to pieces when I got to get on an airplane, or I'm having panic attacks, or I know that you deal with it like individually, case by case, but what could someone expect if they come to you for help with that? Like if it was me coming to you, say, I've got stage fright.
I have to spend some time because when I see people, it's like I can kind of. I've been doing this a long time. I think I figured out there was probably 2 or 300,000 people I've seen doing this, right? Just sitting on the other side of the table from me. So my first job is to like not make to make that flash judgment, but not necessarily go down that road right away because it's easy to, and most of the time it's right, but I don't, you have to kind of do that and then set it aside and then make sure you're not missing something because sometimes you look at the obvious and you don't see what's deeper. So we look at things on a scientific level, with some detailed labs. We look at genomics. We can order other testing that might be fine tune more what that metabolic and inflammatory and immune state the patient's in. And then when we sit down with them at their initial follow-up visit, we go through all of those details. But I'm start off just with really a 4 or 5 minutes of why are you here? What do you want? What are your goals? What is that patient trying to achieve? And listen to them, because they a lot of times by the time they get to me, they've already seen 18 other doctors and been to Mayo Clinic, Cleveland Clinic, and that type of thing.
Mm.
So, we have to listen to what they're telling me because a lot of times the type of problems they have, they've been invalidated in what they're feeling or what their experience is. So we try to create some of that. I'm listening, that somebody's actually listening. That's sometimes shocking to them that someone does listen.
Mhm.
Um, and I want to hear from them, what their goals are. And then we'll go through the physiology of why they're there and look at their labs. And I'll tell them, before we start to work on what I can do with some tools to help you heal yourself. Is there anything out there emotionally, life trauma, physical trauma that's in play? Because I can't, none of the neat 21st century things I've got to offer you are going to override that, right? If that's an underlying thing that's not been dealt with or addressed, you don't have to tell me exactly what it is, but we have to identify it and put them in the right place to be able to work through that. Because if they have emotional life traumas, whatever it is, I mean, it could be all the worst thing you ever thought of to just like, something that I might on the surface not see as super significant to me, but it is to them. and they have to identify that and work through it, because if they don't, they won't achieve the goals they're looking for.
Mm-hmm.
So, there's all, you can think of all the bad stuff that happens to people. We don't need to list that, but
Sure.
a lot of bad stuff happens to people when they're kids and growing up, and
Mm-hmm.
and they don't ever work through it. So,
Right. And it comes out.
oh yeah, it'll come out. And they had a survival mechanism they developed to cope with that, but that way of working through life doesn't translate well into whatever they're doing as a further on in life.
Right.
Mm.
It causes us to make meaning out of things too,
Yeah,
without any proof at all.
right,
You
right,
know,
right. They immediately go to that. It's their default. It's
immediately.
the default way that they're processing the world and interacting with
Hmm.
the environment, and it worked at the time, but it's not a good long-term strategy.
Right. Right. Because we're not
It's
the
hard to
same.
let go of, though, right?
It's hard to let go of because
Mm.
it becomes part of our identity.
Right.
It's like if I let go of this anxiety, if I let go of this Xanax, well, who am I going to be then? What am I going to do then?
Yeah.
Yeah, it's fascinating. So you made reference to something a little while ago that I wanted to ask you about. You mentioned energy medicine.
Mhm.
What is energy medicine?
Well, it encompasses a lot of things, but really, in the way I look at it, is it's really in that really it's something that's developing now in the healthcare setting, is that concept of quantum medicine, of really trying to, how does the world interact with the vibration and sound and light and electromagnetic waves and electromagnetic fields, pulse electromagnetic fields. The body is really functions on a quantum level at the mitochondrial level. It uses energy, moves energy around. It can signal distantly without. We used to look at everything as like you kill it, you cut it into pieces and look it on a plate, and it's really this two-dimensional, maybe three-dimensional way that it works. But there's quantum physiology and quantum mechanics that's at play in the body that allows electromagnetic fields to be used in the body. And then, so energy medicine might be, how do we take devices that emit energy, whether it's red light or whether it's pulsed electromagnetic field or laser, or whatever you would think of in that space, heat or cold even, and use that to help the body's natural processes recover.
Okay.
So
So
it's maybe the way that sometimes the yoga and tai chi and all these other things work. And what is it? There's another one like, um, acupuncture or
yeah,
acupressure. How do those things function in the body? How does that? Maybe it works, but we've never really figured out how it works, right?
right. So when you say energy medicine, if I'm understanding you correctly, like cryotherapy, infrared sauna, those types of healing
They
modalities?
could be,
Okay.
because there's
Okay.
physical things that are affecting the body. It's heat and cold, but it could be certain frequencies of red light. Can control inflammation or augment healing.
Hmm.
You can use electromagnetic fields that are focused and contract muscles or really work on nerve cells. To help them regenerate or stimulate stem cell activity. Focus use of peripheral products. Maybe you infuse something like an exosome, which is a stem cell modulator, and focus it in this particular area of the body by using ultrasound or electromagnetic fields to make it go to the right place.
Hmm. Has anybody, like, off the top of your head, like, any patient that you've had, I mean, I'm sure there are a thousand examples that you could give, but any one patient off the top of your head that has just revamped their entire life from these types of treatments?
There's a lot of them, actually.
I'm
So
sure.
yes, we tell everybody up front, I'm not promising you to fix anything, but we can give you some tools to make it better.
Mhm.
We have to walk a fine line. Western medicine and the FDA, they determine what a treatment and a cure and a is. That's the system determines that. So we don't promise any of that stuff, because then we might be doing false claims in advertising. So
Sure.
right. So anyway, it's sort of a fake paradigm, but we have to live in that world. Yeah.
Right.
So we don't heal anybody else. Yeah, we don't fix anybody, right?
Right.
We just make them better. Yeah.
When I back in and this is a totally relevant story. Back in it was 2016. I had suffered with bladder issues for years,
Mhm.
and went to this urologist in my hometown, and he just prescribed me Cipro and told me I had urinary tract infections, and that's what I thought it was. Well, it wasn't. And then I moved here and started seeing a urologist here that was smarter and wiser. And he said, "Well, your textbook IC. I
Yeah.
mean, you've
Yeah.
got."
Interstitial cystitis. Yeah.
Yeah, he said, "I mean, you've got IC." And And, painful bladder syndrome, and I kinda joked that day because those are my initials, PBS. I said, "Well, that's just really cute." And he's like, "Listen, there's no cure, and, you basically have to live with it, but with some lifestyle changes, um, you can alleviate the symptoms." And he said, "You gotta get the acid out of your diet." And so I ditched coffee, ditched wine overnight, never touched it again, never touched wine again. I've had coffee a few times here and there, but it's been rare. But since 2016, oh, and I must add, the only medication that ever gave me any relief was Urabil.
Mhm.
Well, the insurance companies do not cover that.
Mhm.
Insurance companies do not recognize IC as being any type of legitimate health condition, and it debilitates a lot of women. I mean, most women that I was in all those IC groups and stuff for years and talked to these women, and they're completely debilitated by it, going to the ER all the time,
Wow.
having these painful
Getting punched with
surgeries.
over and over with doses of antibiotics that they probably don't need. Yeah.
Yes, and
Yeah.
I was in that boat. So what I'm getting to is I have been asymptomatic from IC for 2 years,
Oh, great. That'd be
and
life changing. Yeah.
it's life-changing,
Yeah.
and I did it, a lot of different ways, but, like, as you were talking about, that's why I said, "What is energy medicine?" And then as you started talking, that's what I've done
Hmm.
to become asymptomatic. I mean, outside of just a couple of little twinges, I could feel just a little twinge of a flare, which is very rare. If I sit for a long period of time or I eat something that happens to bother me or whatever, but overall, I don't struggle with it anymore.
Yeah, that's great.
Yeah, and I just wanna say that because there are alternatives. Now, when I did struggle with it, yes, I took the Urabel. It saved me. I was able to move forward with that medicine and very thankful for it, and knock on wood, if I
Mhm.
ever need it again, I'll take it.
Right. It's a great tool when you reach crisis moment, right? Kind of help you recover,
Right,
right? You get the day back or get the week back, so you don't just be miserable with that. Yeah.
right.
Yeah.
But if I would have known about this type of approach to healing, um, I wouldn't have gotten to crisis mode
Mhm.
with that. And when I landed at the doctor, that's where I was. And a lot of people in the state of Kentucky, particularly in rural areas, they don't land at the doctor until they're on death's door.
Right.
Yeah. And so a lot of what you do is, I mean, it's preventative, but then it's also, I mean, you do see people who are very sick,
Yeah.
right?
Well, we see the mix is kids and adults. We see mostly kids that have problems. I don't do well visits and well checks, and we don't do any vaccines and any of that kind of stuff.
Mhm.
Um, Most of the kids we see will have a problem. Sometimes we'll see kids that their parents knew they had a problem. They just want to make sure their kid is not going to have that particular problem, from a genetic or risk standpoint.
Mhm.
The patients it's probably a mix what we see as far as adolescents and adults. Some of them are just there because they want to feel better, function better, have improved health span. They have that as their goal and optimize performance or lean body composition and, build muscle, make bone, burn fat, that type of thing.
Mhm.
And work on cognitive issues or cognitive risks. And then we get people that 30% of them or so have kind of been through the mill. They've seen everybody in town. They've seen everybody at a couple specialty centers and been labeled with something but really aren't better. They've just been given a tool to help manage those symptoms. And
Mhm.
that's when we go into a deep dive and spend a lot of time with those patients to help them not necessarily cure anything, but we get them functioning at their best. And sometimes they think they're cured. I just don't, they can say that if they want to.
Right. Right.
Yeah.
Yeah, I understand that.
Yeah.
Um, so I just want to know exactly what led you to this work. I saw somewhere that your wife had struggled with some health issues. Maybe it was, and I can't remember, was it gut issues?
She had some gut issues. She'd always kind of had them since, we've been, together since we were teenagers and have about 8 kids. So we've had a lot of lot of life together.
8
8
kids.
kids, yeah.
Yeah, I saw you talk her, it was you or her I saw talking about that, and I was like, "Oh my god." Yeah.
We grew up in the 70s and 80s, and she was always looking for stuff to try to feel better. Had been through, different nutrition plans and and they ended up having a lot of, bloating, gas, distension, all that kind of stuff. Had always been something that she'd struggled with. And after I forget which one of the kids, she decided I think she was going to be vegetarian to try to be feel better, and like most people to do that, they might feel better initially, but over time, inflammation usually creeps in, and it's not really sustainable for most people to be vegetarian. The human machine's much more of a adaptable omnivore that can needs a little bit of everything to
Mhm.
function at its best. But she had after one of the kids, I guess she had 6 C-sections in 7 years. So that was just a lot of trauma. And talk about vagal nerve trauma.
Right.
That's like a lot of physical trauma to the vagal nerve and not antibiotics and things they give you around these surgeries. So her gut was pretty obliterated and was probably overgrown with yeast, which is not a concept of infected with yeast, but really the microbiome. We know now, like everything is supposed to be balanced. It's supposed to have certain amounts of different kind of things. I always tell the patients in the office, I don't know how you feel about DEI politically, but the gut likes diversity, equity, and inclusion. It wants to see a
Yeah.
bunch of different things, right? And when it's like that and in equilibrium, the immune system works better. So she was having that gut dysregulation, dysbiosis or the wrong balance in her GI tract, and because of that, she was having immune problems, like having, like her varicella virus or HSV-1, which are very very common viruses that almost everybody gets. But if your immune system can't keep them in check, and once you've got them, they're just kind of in there forever, then you'll have outbreaks of those, and she was having that. And then, I was giving her some things in the traditional world to help regulate that, and it would work, but they would just keep coming back. And then one day, I guess she got tired of that, and she looks at me and says, "You can't keep giving me all this stuff. You have to fix this. Whatever you got to do, you got to figure this out. So quit giving me prescriptions." So
Mhm.
I had to go, and that I was already dabbling in some things and learning about how that maybe in traditional medicine we learn a certain path, but it's almost kind of like the Wizard of Oz. It's like don't look behind the curtain and anything else, otherwise everything else is bad. This is the only thing that's good, and that's didn't make sense to me from a distant intellectual standpoint, but that's really the way Western medicine is. You're either in that field or you're not,
Right.
and it's still in the 21st century is not real friendly to people that look outside the box.
Right.
Yeah, and the box is decided by, the whole linear integrated paradigm of, BlackRock and big pharma and big government and big hospital and, that's kind of the rules you practice in that space.
Mhm.
But it's very intellectually limiting.
Yeah.
It's not you're not supposed to think outside that box.
Right.
Yeah. So, but I didn't care. I thought outside the box
Yeah.
and went and looked at what else was out there and tried to figure out a way to use the medical education experience I had and then look at some of these other tools and how might that help me help my wife who had some chronic issues. But then I started applying that to patients we saw
Mhm.
because there's a lot of those that didn't fit the box that Western medicine gave me. And my only option for them was to label them with a psychiatric diagnosis and give them whatever the latest pill was from Big Pharma. That was it. You're depressed. Here's a pill. You've got OCD. Here's a pill.
Yeah.
And it was that just didn't make sense to me. I was like, this is a little bit more in depth and a little bit more four dimensional than just this the binary. You hit these three criteria and you've got a diagnosis. Here's a pill. I mean, that's
Mhm.
and I think most doctors are very intellectually intelligent, but because of the way that system works, they've lost their, critical thinking skills, and they've lost their drive to learn things new.
Their intuition probably gets muffled.
Yeah, yeah.
Yeah. Um, this may be I really do not know the answer to this. So how does gut health play into mental health conditions like anxiety and depression? Because something you said just a few minutes ago struck a chord, and I really don't understand that connection.
Mm. Well, your microbiome in your gut is responsible for a lot of your neurotransmitter production, or at least providing the precursors for you to make your neurotransmitters. And that balance of acetylcholine and serotonin and norepinephrine and GABA, whatever one you're looking at, that balance is going to be driven by the ability to first of all structurally make those things, and to keep them in balance. And the microbiome also, when it's not functioning properly or has overgrowth with certain type of bacteria or too many carbs in it, or it will release things that are essentially what's called endotoxins, and they will get into the bloodstream and float around, and they can cross into the brain and inflame the brain. So modern research is looking really at a lot of psychiatric diagnosis as neuroautoimmune or neuroinflammatory conditions. So most of that stuff drives from gut dysfunction, where that single layer of membrane between the outside world and the inside of your body and your GI tract, there's still a single layer membrane between your brain and the rest of the body. It's called a blood-brain barrier. So when that single layer membrane breaks down in the GI tract, it often breaks down protecting your brain. And then you have immune dysregulation in the brain and upregulation of the microglial cells there. And they get stuck in that on or in that inflammatory position.
Do you see a lot of that in women who are perimenopausal?
Well, hormones absolutely affect how your brain works. I
Oh
mean,
yeah.
I have to walk a fine line here with my wife and daughters and then patients in the office. But, I have a graph I show ladies of their hormones from the time they hit puberty, that it cycles every month
Yes.
until they go through menopause. But there's 5 or 6 hormones that are just going all over the place throughout the month.
Mhm.
And then I'll show them a picture of guys' hormones, and it's like it's pretty much just 1 or 2 flat lines,
Yeah.
So it's
Yeah.
just different, for guys the way their body functions. But yes,
Completely.
yeah, the brain is impacted by hormones, and
Yes.
your mood and your behavior is impacted by it. And most ladies know that, and they don't
Mhm.
necessarily understand how it works inside them. They may discern the patterns,
Mhm.
but they don't. Most of them, just like you don't understand your anatomy, they don't understand. Maybe estrogen's a little high here and progesterone's low, and that affects how I feel.
Mhm.
You know.
Yeah, I just had to ask that question because I didn't really know what was going on with me, and I seriously just woke up one morning and it's like somebody came and just stole my personality in the middle of the night,
Yeah.
and it took a while to get it back.
Yeah. Yeah.
And it was just because my hormones were so out of whack, and I was in perimenopause and I didn't realize it.
Right.
And
And
then I
it sneaks
trans
up on you most of the time. It's not, just suddenly you're in menopause. It's not like,
right.
oh,
No,
that's
it's
it. Yeah.
yeah, I mean several years there.
Mhm.
And I did hormone replacement therapy and I still do. And that just really worked wonders.
Mhm.
Oh my goodness. And that's really, really connected to mental health as well. And I
Yeah, well, there's literally been patients or women who maybe go through menopause and don't realize and ended up with major psychiatric
yes.
diagnosis and even institutionalized, but then once they get their hormones straightened out, it stabilizes and they're able to
Yeah.
function normally again.
Right. And they feel I mean, you feel crazy. I mean, you
Yeah.
really do. I mean, it's like a total complete change. It's like a night and day change. And so I had to ask that question.
Yeah. It's
Uh,
real.
Yeah, it is very real. I gotta watch my time here because I'm gonna keep you too long if I don't stop. So,
I've
I,
just got to figure out where to go out to eat tonight. Terry's out of town and it's me and 2 girls and I'm not cooking.
oh, I don't blame you. I don't blame you. And
Yeah.
hopefully the weather clears up a little bit
Yeah.
so you guys don't have to get out in an
Yeah.
absolute disaster. Um, so I want to talk about your event coming up on
Mhm.
March the 25th. Mind Matters: The Future of Mental Wellness and Cognition.
So we'll at that event we'll have a little talk. I think I'm going to speak on kind of what we discussed, which is really how GI health, how nutrition, how cellular optimization, controlling immunity, managing overactive inflammatory response can impact mental health. And then we'll also have a new energy device called the Exomind that we will introduce. It uses pulsed electromagnetic fields to work on the dorsolateral prefrontal cortex for obsessive eating disorders, for depression. Right,
Really?
right, right. So we're going to have that energy device and introduce it at that talk. We're the first ones in the area, I think, to have that.
Yeah, that's incredible.
And they've used sort of like transcranial magnetic field devices before in depression, but they take a long time. You have to sit there, have to go back for multiple visits, and essentially it's a refinement of that technology to have to not spend so much time sitting there exposed to these things.
So is it like a one-time treatment or is it a
No, it
series or
cuts it significantly. I don't want to quote it because it depends on which particular, what state we're trying to work with. But well, maybe 6 weeks or less, which isn't bad.
no, not at all.
Yeah, 6
And
sessions. I think yeah, that's what I mean to say. Yeah,
mhm.
yeah.
And I mean, it will last like a lifetime, or do you have to keep, or do you
You
go
know, it
back?
kind of it's essentially reprogramming a bit when you do that
Okay.
is the way to think of it, and it kind of depends on the patients. You know, what do they do when they go out back into life? Are they going to nurture that reprogramming and walk the walk and make the nutrition and dietary and lifestyle changes? And to do that, I suspect it'll be like a lot of these things. We can nudge the system in that direction. They're going to be better, and then we might have to hit it again a couple of times, downstream just to remind the
Mhm.
system how to function properly.
Right.
But that really gets into that quantum medicine thing. You're using cell signaling and with electromagnetic fields essentially, which is just such a neat concept. So you should have a talk sometimes on quantum medicine. I think that's a good one.
Oh, yeah,
Yeah.
definitely. So you mentioned nutrition. Is there a particular diet that you advocate for? Is it the Mediterranean diet or the
We call it Mediterranean paleo, where the paleo overlay is going to be grass fed, wild caught,
yeah.
no hormones, no steroids on your food or the thing your animals that you eat are eating.
Mhm.
So very clean source stuff, watching the seed oils. And it tends to limit grain for most people because it's full of carbs and can be inflammatory. And some people have very specific targeted things they shouldn't eat in the grain world. And we were able to look for those and fine tune that for them. The Mediterranean part, I always tell the patients it's not a Mediterranean diet, it's a Mediterranean lifestyle. So, they go down to the market and just pick their fresh food and fish that's caught and prepared for the day, and they go back and prepare it and eat it. So, trying to be close to where your food was prepared and not having, if you have to freeze it because of where you live, that's okay. But eating things out of a box and a bag and, having all of the artificial seed oils and things, preservatives put in there to make it sit on the shelf for 6 months so it doesn't rot, you want to avoid those type of things. And part of Mediterranean lifestyle is sitting down, at least in today's modern Western world, at least one meal a day with your group and eat slower and try to communicate a little bit and work on some relationships.
Mhm.
So that's really Mediterranean paleo lifestyle is what we would use as a term. And we offer classes to train people in that, and we send them home with a lot of information to help them execute. Sometimes it's a matter of I'm so busy I don't have time to do that, and then we help them connect with people that can prep meals for them and just have them delivered, that type of thing.
Interesting.
Yeah.
It sounds a lot like the Ayurveda diet that
Mhm.
I
Yeah, well,
adopted that lifestyle a couple of years ago.
they've been making food a long time in India, right?
Yeah.
So
Yeah. And the biggest thing I've noticed is now I'm not 100% off of processed foods. And the
Mhm.
only reason I'm not is because it can be really hard to follow.
It is, and it's hard to access source it in this country.
It is.
Yeah.
And processed foods are horrible.
Yeah, we have a restaurant I'll show you, it's called Sapiens Kitchen, and it's keto free, paleo, no gluten, all this, and I'll show it to the patients, and then I show them the address. It's in Scottsdale, so it's like, we're sort of in a in the cellular phone world in a dead food zone in Kentucky. There's good places, but there's
Mhm.
not very many.
Right.
But we do have the sourcing. You've got a lot of farmers that'll do organic and prepare things. You can work your local food markets and talk to see what they're feeding their animals and what they're spraying on their crops, and you can find good sources, but it requires some effort. You
Mm-hmm.
can't just go down to the local big box grocery store and find a lot of this stuff.
Right. I got have you heard of the Yucca app?
Yes, yes, yeah.
I don't know if
Mhm.
that app is accurate.
I've heard of it. I've not used it, and there's several apps you can use to find seed oils, to find paleo food, and they get you started, and then you just have to talk to whoever's in there when you go.
Yeah,
But any effort you can make to move in that direction is going to be better than just the. I mean, I was excited. Who was it? Was it um, Steak and Shake that now uses beef tallow? Did you see that the other day in
I
their
did
fries?
not.
Yeah, so they got rid of the seed oils and they got pushed in. I think it's since the Kennedy guys
Yeah.
pushing the buttons on that now that, I don't eat Steak and Shake fries, but if
Mhm.
I'm gonna have to try them, I think, to see what they
I
taste
may
like.
have to try them
Yeah,
too. I haven't had Steak and Shake fries in a long time. Going through fast food restaurant is just not I can't even fathom that in this day and time, and I used to be a
yeah,
fast food junkie.
yeah. Most of the time, don't eat breakfast, skip lunch, and just eat a really healthy meal in the evening. I try to about 3 days a week eat something during the day, but
Mhm.
and I run on ketones most of the time. I'll use ketones during the day,
Mhm.
to keep, you can burn fat, protein, carbs, and ketones as a fourth fuel.
Mhm.
They go straight to your brain and your heart and give you lots of energy. And
So when you say you run on ketones,
Mhm.
would you tell me a little bit more about that?
The ketones are beta hydroxybutyrate, so it's the most common ketone body the body would make if you fasted. But in the miracle of the 21st century, they can manufacture beta hydroxybutyrate and put it in a little liquid jar. And a lot of athletes used it for performance enhancement. The anaerobic athletes will use it before the first half, second half. The aerobic athletes might use it at, long distance bike and running, might use it after a run to preserve their muscles. They've got that ketone to burn so they don't chew up their muscles as a recovery in the recovery phase. But we use it a lot for cognitive enhancement. I'll use it in little old people with Alzheimer's because getting that energy in the brain can help them function better. We use it in some kids with autism spectrum, because getting that energy into the cell allows it to function more efficiently. I use it to support fasting. So you don't really technically fast when you have a ketone, but you don't signal the insulin release that you would get if you ate a carb or a protein or fat. So you keep insulin levels down with that. So it's much smoother energy release.
So this is like a supplement.
It's a supplement. Yeah.
Okay.
Yeah.
Okay.
Yeah.
Okay.
Now you can make your own ketones, but if you're in ketosis a lot, you're going to be burning up fat and you might burn up some muscle. So we want to keep muscle density. That's the thing. As we get older, it's hard to do, right?
Right. Oh yeah,
Yeah.
right. Yeah, I could just keep on asking. I could seriously keep on asking questions. And so I'll close with this because I'm planning to come to your event on the 25th. It's from 6 to 8 o'clock at the Medical Transformation Center, 13111 East Point Park Boulevard, Louisville, Kentucky 40223.
That's correct.
And so is this like an open house type of event, or do people so you'll be speaking?
I believe it's an open house event.
Okay.
Yeah, yeah.
Okay.
Yeah, I'm the worst person to ask those type of questions.
They just put you on stage.
They put me on stage or put me back in a room and say, see patients all day long. Yeah.
Yeah.
But they can clarify that with you, whoever you drop the podcast to and let them
Sure.
know.
Okay. Okay. And are you open Monday through Friday
The
at the
office is currently open Tuesday through Friday.
Okay.
Those 4 days a week. We'll probably add Monday at some point just because we're getting busier. But
Okay.
I learned if you could not be there on Monday, then most of the time or Friday it'll wait.
Yeah. Oh yeah.
Yeah.
One more thing, and I swear I'm going to stop asking you questions, but so I'm just like really, really open about everything that I do. I don't care if people know that I've got Botox and fillers and all of that stuff. I just don't. It's
Yeah.
like, so I'm very open about it. And I'm 48 and I started doing Botox when I was 32. And then as the years went on, I started fillers. And so wrestling lift, Juvederm, wrestling lift, Botox. Okay. And I have heard about the stem cell therapy facials for a really long time. And I heard your wife talking about it on WHS 11, maybe.
Probably.
Yeah. And she explained it in a
Probably
way.
Claudia. She goes in there with Claudia, somebody.
Yes.
Is that WHS? Yeah.
Yes.
Yeah.
And she explained it in a way that I mean, she was a really great teacher that I understood it. And so I would just like, if any of our listeners are interested, I would love for you to just give us
Explain that. Yeah.
an overview of the procedure. And I'm going to call and make an appointment, like I'm calling on, if you're open on Tuesday, I'll call Tuesday, make an appointment. Just what can be expected, procedure, time spent, investment, just the whole nine.
Well, it's cheaper than surgery for sure, right? It's going to be more than getting PRP, which is just blood. You take blood and spin it, and you get growth factors out of blood. The procedure we do on the face, particularly, pulls bone marrow off your hip, which sounds awful, but it doesn't matter what your body shape and composition is. That bone we pull it off of, this sits right up on the surface, and we pull that, and it goes through a FDA-approved machine to spin out your mesenchymal stem cells is what they're called. And they're very good at signaling you to produce more collagen. And particularly what we're trying to achieve in the face is elasticity and skin tone. And when we put the PRP plus your own stem cells into your face, it will allow you to regenerate collagen in those areas on your own. So it's not designed to be like a filler, which will go in and artificially create volume, and then it kind of wears out and you have to put more in there to maintain the volume, right? This allows your body to generate its own volume in those spaces with your own tissue. So it is, stem cells are the things that make collagen, stimulate collagen production. The PRP is the growth factors that sort of feed that. So you wouldn't expect to see that blown out look like you would see after immediately getting an injection.
I've had it.
Right, right. That's not really the goal of it. There will be some volume just because we put something in there.
Hmm.
And that usually peaks at about 2 weeks. It creates a local inflammatory response, which is, again, inflammation in this case is desirable because
Good.
that
Yeah.
causes the collagen and hyaluronic acid of your own production to rush into those areas.
Hmm.
And you'll see a smoothing of contours, smoothing of fine lines and wrinkles, and some volume over time, but it's not going to be like immediate volume if that's what you're thinking with it. And we combine that with some of our energy devices that work on the muscles and the bones of the face that will allow you to get contraction of the muscles through pulsed electromagnetic fields that's very focused and create, volume and bone density. So, if you lose bone in your legs as you get older and have a hip fracture, you literally lose bones in your face
Oh,
and,
yeah.
and you lose, and that's part of how the shape changes. So,
You
if-
hollow.
right, right. If you
Yeah.
just artificially put volume on the surface of it, it might look okay, but you're not really working on the underlying pathophysiology of why your face shape has changed.
Any downtime after
Not
you have the.
Usually not much at all. Now there's some bruising because we did, inject things in there. So
Sure.
so some lady, the most we've heard ladies is like a week. Some ladies are like, we had a lady do it, and 2 days later she was at one of our events. She just wanted to
Mhm.
come, and ladies do magic things with their skincare.
Oh,
You
yeah.
couldn't really see anything.
Yeah. I mean, I have gone out in public, bleeding before after leaving my aesthetics clinic. It's like I don't even care.
And we use those same things in knees and hips and shoulders.
Mhm.
They help regenerate collagen in those areas. You can't take a torn ligament and magically glue it back together. But if it's a frayed ligament or partially torn, or you've just lost some cartilage, combining those, that technology with the bone marrow aspirate mesenchymal stem cells with concentrated PRP has been effective.
Mhm.
And then you would always want to do some of those procedures before you just went straight to steroids, which tends to degrade the cartilage and the tissue,
Mhm.
and accelerates the need to end up getting replacements at some point.
Mhm. And you do all of that in
Those
your.
are outpatient things we just do in the office suite there, and it doesn't require any. There's some local anesthesia, but it doesn't require any sedation.
Right.
No,
Okay.
so it's very safe that way.
Okay.
And
And
they're your own stuff. You don't really
right.
react
No
to your own things.
toxins. No
Right, right.
toxins. Yeah.
You can't react to your own tissue.
Right.
Except in a positive way.
Right. And the facials, how long do they last? How long does it take?
A lot of people will do one, maybe 6 months to a year, do another one, and then it depends on how you take care of yourself.
Yeah.
And we always encourage the patients to really look at overall, are you healthy? Is your sugar under control? Are you managing your hormones properly? We use a lot of peptides to augment soft tissue and collagen recovery and augment growth hormone release naturally, which all of those things help your body regenerate better on its own.
Mhm.
So it's all about enhancing recovery for the, exercise recovery from, enhancing deep sleep, you know,
Right.
getting hormones lined up properly, making sure you've got the right nutrition, you can burn fat, protein, and carbs efficiently on a cellular level,
Mhm.
and then layer over that energy devices that works more in the quantum medicine space. And then sometimes we pull little things from your bone marrow and put them where you need them most to
Right.
concentrate it there.
Yeah, you guys are gonna have to get me a cot, I think, at the medical transformations. I'm not joking. And Will's sitting back here. I know what he's thinking. He's going, "Oh God."
He's like, oh no, not really.
I'm thinking I want to do it too.
Yeah. Yeah, I'm looking really forward to making an appointment, and I'm glad that
Well, thank
I found out
Yeah.
about you and your wife, and I can't wait to meet her.
Yeah.
And before we close out, anything else you want to share with our listeners?
It's just that I enjoy what I'm doing. It's a lot of fun. I can do this for a lot longer. God willing, I'll maintain good health and my brain hangs in there for, another 15, 20 years. I don't go at the pace I used to go, but I really feel the things we offer now are things that the community needs, that patients need. It's still in that early adopter phase, I would say, for people to do this. But if you go nationally or internationally, these type of things we do are it's what is in demand. And it used to just be the baby boomers and it was millennials. And, now we see these, 25 and 30-year-olds that which, I really appreciate that they think this way. They want to start being healthy now. Don't want to wait till they end up like mom and dad and have to fix it.
Exactly. And what's the use in living to be 90 or 95 if you're in this frail, sick body? It's
Yeah.
like, what's the use?
You want to be in the game. I don't mind if it's the fourth quarter, maybe a little bit
Yeah.
overtime, but I still want to be in the game.
And I want to feel good.
Yeah.
I mean, that's it. I mean, that's where it's at. So, yeah.
Well, thanks for inviting us.
Oh, my goodness. Thank you so much. Yeah. Thanks.
The Thought Snob Podcast with Paula Swope has been brought to you by Thought Snob Media in association with Special Purpose Studios. All production, mixing, and sound engineering by me, Will Swope. We hope you've enjoyed this podcast. Please take a few seconds to give us 5 stars and leave a review. See you on the next Thought Snob Podcast with Paula Swope.